Diagnosing navicular disease, we have a few methods. This is the frog wedge test, so you can see this is the frog. And it's quite simple, really. You place the wedge of the wood under, the wedge of the wood under the palmar 2/3 of the frog and force the horse to stand on it for 60 seconds. And you see a positive pain response to the hoof tester pressure over the central third. So this can be painful, the frog wedge test. For 30 seconds, or this can be painful for the hoof tester pressure over the central third of the frog. So you can see the frog can be split into thirds. They're putting the pressure there. Now, what you can also do is what we call a low palmar digital nerve block. Basically, you put a small volume of anesthetic, maybe 1 ml, and apply axially and distally to the proximal limit of the collateral ligaments. So yeah, just to show you what the anatomy would look like, you put it sort of in this blue nerve here, which is the low palmar digital nerve. You can also do intrasynovial anesthesia of the DIP joint. Really don't know what that is, I'm sorry. And what you might see is pain from the impar ligament. What you can also do is intrasynovial anesthesia of the navicular bursa. You can put like 5 to 6 mils of anesthetic and assess the response of the nerve block within, let's say, 5 to 10 minutes. Now, what you can also do is, of course, x-ray is very helpful there. So what you can do is see the bone density. There can be a 40% change in bone density before you can even see it in radiographs. So quite a big change. And you do a complete evaluation of the navicular bone, which requires a minimum of 3 views, let's say. So this is, for example, a lateromedial view. There's also weight bearing at 65 degrees. And yeah, it says up here, the dorsoproximal palmaro-distal oblique. Yeah, I don't know how to say it. Yeah, just try and remember it. Or the dorso-palmar view with the limb elevated on what we call a Hickman block, which is placed at 85 to 90 degrees. So it's almost at a total right angle to the land. And yeah, you can do an x-ray here, basically. So just to be clear, all the stuff we're talking about from this slide is x-rays. Now, if you do the I'll show you the words, the palmaro-proximal palmaro-distal oblique, 45 degree, which is also known as skyline. It's at 45 degrees, so I don't know if you can see it here, but yeah, it's at like a really awkward 45-degree angle. That's another way you can do x-ray. So the whole point of these x-ray slides is to say to you, okay, we have to take x-rays at different views. And why is that? Because we want to look for not just angles and if there's a pain response, but also just any abnormality. So enthesiophytes is an example. You can see this at the proximo-medial and lateral parts of the bone. So this means, like, you know, the parts of the bone that are closest to the body and on the right and left sides. The proximal or distal extension of the flexor border, irregularities of the surface, fragments, what else? Radiolucent zones, like with synovial invaginations, for example. You can also see cyst-like lesions in the medulla of the bone. So you'll see like radiolucent areas. What else? Increased thickness of the flexor cortex, sclerosis, so breakdown of the spongiosa, flexor cortex lesions, and what else? Loss of demarcation of the flexor cortex and medulla. Sorry, that was just skimmed because there's a lot. I don't know this, but yeah, you could see defects of the flexor cortex or erosions, loss of the corticomedullary distinction. So basically, when you look at the bone, the cortex and the medulla should look very different. If they don't, that's not good. And you can also see mineralization of supporting ligaments of the navicular bone or the deep digital flexor tendon. These should be more flexible, and they might not be. So yeah, these are just showing some examples. So cyst-like lesions in the medullary cavity will look a bit like, it's very difficult to see here, but you can see this is mostly white and this is a bit off-white. It's quite subtle. You might also see multiple small or even large, variably shaped distal border radiolucent zones. So these are zones that are like, let's say, darker, like more see-through. Because you have enlarged synovial invaginations. And enthesiophytes, what are these? What do they look like? Sorry, they are usually on the wings of the navicular bone. So if you see something spiky like these are enthesiophytes. Dystrophic mineralization in the deep digital flexor tendon. So we know that the bones should always look like this. If I just cover that with my pinky, this shouldn't exist. Now, if we're looking at diseased bone, let's look at this one because it's a bit nasty. You can see erosive degeneration of the flexor cortex and enthesiophyte formation, so bone that shouldn't be there, on the proximal or distal borders of the navicular bone. Fraying